A lot of my patients ask how to safely reincorporate vegetables into the diet to get the maximum nutrition from them. So in general, I recommend that patients peel and cook their vegetables, and they want them to be fork tender. And then for some patients who have an ileostomy or a stricture, I often recommend pureeing them into a really creamy soup, and this way they can have all of that great nutrition without any added risk of obstruction. When patients are looking to reincorporate vegetables into the diet, I love to start with starchy vegetables such as a potato. Potatoes can be peeled and cooked into mashed potatoes, roasted potatoes, or even French fries.
Those are some great tips, Stephanie. And similarly, winter squash like butternut squash, acorn squash, and pumpkin are really great IBD-friendly options. You can bake them, you can blend them into soups as well, and they're actually really great sources of soluble fiber, which is a special type of fiber that's especially gentle on the gut, and it actually helps to slow down GI transit time, meaning food will move more slowly through the GI tract, which can help with urgency, and it can also help to bulk up and solidify stool.
That's such a great tip. I also like to recommend carrots and parsnips for our patients. This is a nice vegetable that they can really just cook until fork tender, and they can get a lot of great nutrition from them.
What about canned and frozen vegetables?
Canned and frozen vegetables are actually a lot softer in texture, and frozen vegetables in particular are just as nutritious as fresh. They're actually frozen at peak ripeness, which helps to preserve vitamins and minerals.
Absolutely, and I often tell our patients if they're looking for a canned vegetable, just to get one that isn't packed with any additional sodium or salt. And then those vegetables, as you said, can be nice and soft, and it's a great way for our patients to start to reincorporate vegetables into the diet.
What about other vegetables?
A lot of our patients ask about broccoli and cauliflower because they feel that these are vegetables they may not be able to tolerate. What I usually recommend for these is starting with a soup, and so a nice creamy broccoli cheddar soup or a creamy cauliflower soup are great options. I also tell patients that if they remove the stalk and try to just have the tops of the broccoli and cauliflower, they may produce less gas and they may be more comfortable. A lot of patients also ask about onions. I think this is a topic that comes up a lot. For our patients who are having a lot of active symptoms, or maybe who have just come out of the hospital or had a recent surgery, I try to stick with onion powder as a flavoring without the actual vegetable. But as patients are feeling better and getting into remission, cooked onions are fantastic, and some patients can actually tolerate raw.
Those are some great options, and in addition, bell peppers can be another great option. If you cook them and peel them, they become very soft, and similarly, you can even find jarred bell peppers in the store, and then they're already prepared for you, super easy. In addition, there are different greens that can be great for IBD. You may just have to modify the textures a bit so that you tolerate them better. For example, spinach can get really soft if you chop it up and then saute it or steam it. You can even blend it into smoothies and soups. And then kale is pretty rough when it's raw. It has a rough texture. However, if you cook it and then puree it, blend it in with a soup, you can get it really, really soft, and it can become a lot more digestible.
That's a great point, and then patients can get all the great nutrition from these greens without having the added risk.
Exactly.
What about patients with an ileostomy?
Our patients with an ileostomy are often avoiding so many vegetables. So for these patients specifically, I'm really focused on texture modification. So the smoother the better is my mantra in clinic. So what does that mean? We really want to make sure that those patients are cooking and peeling all of their vegetables, and I love the concept of making soups for them. I'll give you an example. Mushrooms often are difficult to digest, but when patients make them into a creamy mushroom soup, they get all that flavor and nutrition without any of the risk of a bowel obstruction.
Thank you both so much. I think this will be really helpful for all the patients living with IBD.